Hi, I'm Brian Clowers. I'm an orthopedic surgeon and I have subspecialty training in the foot and ankle. Orthopedics in general, I don't think most people understand that it's become a very subspecialized field, and there are niches that individuals get into, and every field's gotten that way, but orthopedics specifically. So foot and ankle is one of those subspecialty areas where you can spend an entire year training in that area and still not feel like you're a complete expert, but it's also an area where some general orthopedists don't have as much experience and don't feel comfortable taking care of those more advanced or complex injuries or pathologies, and so we certainly find our place there. That's a pretty wide range, you know, starting with relatively minor injuries like sprains and things of that nature. I also deal with complex fractures around the foot and the ankle, even up higher in the leg. Below, you know, I usually tell folks most of what I do is below the knee, so that can even include the shin bone, the tibia, and the fibula. So complex fractures, there can be chronic or attritional injuries that we deal with as well. You know, folks who have been athletes all their lives and have put a lot of miles on their foot and end up with more chronic type injuries. So we really get to see the entire spectrum of those types of injuries. I'm a surgeon, I like to operate, but I always tell individuals if I can keep them out of the operating room, then that's a win for them as well. And so I think the biggest enjoyment is really interacting with people. I get to see people all day long, whether it's in the operating room or whether it's in the clinic. And so I think that's the most enjoyable part, is kind of getting a chance to not only take care of their problem, but hear a little bit about their story and what got them to that point, and hopefully become a successful part of that story if things go the way we want them to.